we're going to start off before we get into attendee questions on the topic of being in San Antonio. This morning I presented to a group of high school juniors. There's a great program here in San Antonio called Alamo Academies, kind of a bridge from high school to college for different career paths, and they have what they call a health professions academy. And so I led some discussion with them about their future in healthcare, which hopefully includes playing a role in improving healthcare. So Greg, in your role as a physician and the CEO of KaiNexus, what would you say to a group of high school juniors about their future in healthcare?
Well, for one, the act alone of the fact that we're talking about a group of high school students that are getting exposed to process improvement at this point in their career is just simply amazing. I mean, you counter that with the fact that I went not only through high school, college, medical school, and residency without ever hearing the words process improvement. I think that really bodes well for the future of healthcare. And to me, I think what we really need in healthcare, and what I'm learning, we just last week we were at the lean construction conference, and LCI conference, and we learned, and I saw another industry that was a perfect application for lean principles and lean practice. So what we're learning, and I think the biggest things that young people can take into the field of medicine is that it's not going to be just a learn and do what everyone has been doing. It's just a huge opportunity to come in and really reshape the way healthcare is practiced and delivered in the United States. Sometimes the old guard says, oh, healthcare is not what it used to be, and it's such a bad time, don't go into healthcare. To me, I would say, for all of those reasons, those are all the reasons I would want to go into healthcare, because there's just so much good to be done. So I'm really happy to hear you were able to present to those students, and I think it's the future is very bright in healthcare.
Yeah, and I was really impressed with the kids because in a lot of ways their intuition is really, really good. We talked about suggestion box systems, and it was kind of teeing up. I showed them parts of the Toast Kaizen video and had them go through the process of identify some waste, identify a problem, think of some solutions. And when I asked, with the suggestion box, if you were to fill out one of these slips and put it in a suggestion box, what would you expect would happen? And there was some laughter, and there's like, well, would they read it? I think a lot of these kids haven't worked in a workplace with a suggestion box, but it seems really intuitive to them that it's dumb to put an idea in a locked box. And I asked them, what percentage of ideas would you guess are approved in a typical suggestion box system? And there's research to back this. And one kid said 5%. Then another kid says 2%. I'm like, yeah, I think that's the number. That's the Robinson and Schroeder number of typically suggestion box systems are roughly about 2% implementation rate. So yeah, I tried to set that expectation for them. That I shared this story. One of our customers, Karen Kilrosser from Mary Greeley Medical Center, who has adopted the Toyota mindset of everyone having two jobs, doing your job and improving your job. And that's why I tried to get across to them that they can not just treat patients, but they can help treat the healthcare system and improve